I'm Dr. David Hill, and today we're talking about newborn ear infection. Now, this is not an ear infection that just got born. I think we're talking about babies who just got born and have ear infections. The good news is that in newborn babies, ear infections are really quite rare. Why is that? Well, it's probably because to a large extent, they're protected by the antibodies that they get from the mother's bloodstream before they're born. Now, if you're breastfeeding your infant, nursing, you're also giving that infant further protection against ear infections and other infections as well, because you're giving that infant the gift of your own antibodies through the breast milk to protect them. Signs of ear infection that we look for in older infants are not reliable in newborns. They can't reach their ears. They can't necessarily show you what's hurting them. If they have a fever, you should never assume that's an ear infection, because a fever in a newborn, in any baby under 3 months of age, could be a sign of a very dangerous infection of the bloodstream, of the kidneys, or of the fluid around the brain and spinal cord. So if your newborn has a fever of 100.4 degrees or greater Fahrenheit in the rectum, or of 38.0 degrees centigrade or greater rectally, that is a medical emergency. You want to have that baby checked out right now and not think, well, he or she's a little fussy, maybe their ear is infected. It's probably not. Ear infections are rare enough in newborns that we have a hard time knowing what to do about them. Do we give an oral antibiotic and cover up a potentially more serious infection? You'll have to talk to your doctor about what he or she thinks is most prudent. The other thing is it's difficult to diagnose ear infections, even for the doctor, because the newborn ear canals are really, really skinny, and the tools that we have to look in the ear often aren't as skinny as the canal that we're trying to look into. So it can be a real challenge to figure out if a newborn has an ear infection. What are some basic rules to go by? If your newborn baby is exceptionally fussy, certainly if he or she has a fever, if he or she has cold symptoms that are making it difficult to feed or to sleep, then for gosh sake, take that baby in and get the doctor to get a look at him. At that age, so many things can go wrong that you really just want to get them checked out. Talking about ear infections in newborns, as opposed to newborn ear infections, I'm Dr. David Hill.